Welcome to Premier Pain Talk, a podcast dedicated to expanding awareness about treatment options for people in pain. Each week, host Dr. Michael Danko from Premier Pain Treatment Institute in Cincinnati, Ohio, discusses cutting-edge treatments for pain management that are improving the quality of life for those suffering with chronic pain. Tune in now to learn more about how to relieve pain and restore your quality of life.
All right, well, we're going to get started here. So I'm Dr. Michael Danko at Premier Pain Treatment Institute in Cincinnati, Ohio, and we're going to be discussing a therapy called spinal cord stimulation for a treatment called diabetic peripheral neuropathy. So I'm trained at Ohio State for medical school, then I trained at University of Cincinnati for anesthesiology, and then at a specialty fellowship in pain management. I opened Premier Pain Treatment Institute about 2016, and then since then we've been managing patients throughout the tri-state area here in Cincinnati. We have four locations. We have our Loveland office where I'm at now recording this podcast and webinar, and then we have our Mount Orb office. We have Hillsborough and Middletown. So overall, the main focus for tonight is going to be treatment for painful diabetic neuropathy. So what that is, it's a nerve condition that's caused by diabetes that causes chronic pain and tingling and burning and other kinds of symptoms in the feet and the legs. So we're going to talk a little bit about and try to understand that a little bit more. We're going to talk about proven pain management solutions for that type of pain, and then we're going to talk about really the main focus for this webinar, which is spinal cord stimulation. And then lastly, we'll see if anybody has any questions that they want me to address. So if you are following us online and you want to drop us a question in the chat, I'll address those at the QA session at the end. This is for neuropathy, and common condition. And for those of you that have this condition, that you're not alone. So 15% of patients with diabetes do have neuropathy that is painful and really causing discomfort. And that ends up being 6 million people. So that's a lot of people that have this problem. So you're not alone with this. This is something that happens if you have diabetes that is significant enough and progresses enough. This is a progressive neurological disorder, so it is something that is going to develop for those of you that that your diabetes does progress. There are a lot of treatment options. We're going to talk about a few of them on the next slide, but one of them that we're going to really focus on as we get through the introductory portion of this presentation is something called spinal cord stimulation. So that's a therapy that's really well established, and as the slide shows, it's been around for 50 years, so it's not new. It's older than me. When you do have stimulation, one of the best parts about this therapy is you can test it before you get it. So I often kind of say you can try it before you drive it. So as far as options for diabetic neuropathy, you have a lot of medications that we try. So there's gabapentin, there's Lyrica or pregabalin, amitriptyline, duloxetine, Cymbalta, capsaicin cream. I'm not sure any of these words are familiar to you, or if you're currently on these medications. There are patch therapies, something called the Qutenza patch that's approved for neuropathy. That is a once every 3-month treatment we do. There's injection that we try for this. There's something called a lumbar sympathetic block. So that is a combination of a local anesthetic and a steroid to try to relieve the pain. So, unfortunately, a lot of people with diabetes, their sugars can't really tolerate the steroid in that injection. But if you have a pretty stable A1C and your sugar doesn't get too crazy when you get subjected to steroids, that may be an option. But as I mentioned, for a lot of people with diabetes, any kind of steroid injection usually shoots the sugar through the roof. And then, as I mentioned, spinal cord stimulation, and we're kind of keep teeing it up because I think it's ultimately it's a really great therapy. It's something that I really enjoy offering patients. We've had a lot of good results with it. So as the slide mentions here, you can test drive the therapy. So that's something we call a trial. I was having lunch today with our district manager, Doug, and he mentioned how the word trial doesn't really have such a great connotation, that their test drive is a little bit better. And I think it's kind of genius. And I started thinking in that moment, anytime I heard the word trial, that really sounds pretty punitive. So I think I think about going to court, and I don't really want to be on trial. So I kind of was kind of like a little bit of a light bulb moment for me, where like maybe I don't really want to mention that you can try it or trial it for 7 days. It's really you're testing it. So you get the therapy, you get to see how it works for you for a week, and then at the end of the week, if it was really well controlling the pain, if you were sleeping better, if your mood was better, if a lot of the things that you were trying to do were improved, then it's really a successful test, and you didn't have to stay in trial in the meantime. So the way this therapy works at like a really high level is it's ultimately changing the way we're signaling the spinal cord. So, it's taking painful, noxious stimulation that is coming from the neuropathy and really turning it down or making you feel like you have less pain, less tingling, less numbness. And there's a lot of ways it works, but one way that Medtronic has shown that it works is through trying to change that more back to a normal, more healthy signal. So, when we have a normal, healthy signal, that's also kind of equates to no pain and no tingling and no numbness and a lot of the problems with diabetic neuropathy. So we're kind of trying to take it from that painful state and turn it back to the normal, healthy state. As far as total similar devices out there, the Medtronic data shows that there's over 430,000 people with chronic pain who've chosen this therapy. So this is not experimental. This is not something where it's lightly represented. This is also throughout the world. So a lot like the most every country in the world has Medtronic representation. So if this works really well and you're here in Cincinnati and you wanna move to England, feel free. Plenty of support there. So the way we start this out is we see you in clinic. We really talk about what's going on with your therapy, what we've done so far, what's working, what's not working. And then if we're really not hitting the kind of functional goals that you want, if you're not achieving the kind of relief that you want with what we're doing, and we decide that stimulation is a good option for you, I think we want to say, okay, like, these are the things that we think this therapy can do for you, and these are the goals we're going to set for when we do test this, that you're gonna really see how many of these you achieve. Then we test it, and then if the test really works really well, then we go to implantation, which typically that'll be about 4 to 6 weeks after the trial. So we try to this is an elective outpatient procedure, so we want to make sure that you've got appropriate medical clearance in that. So we try to relatively quickly go from the test to the implant, but also want to make sure we're taking all the appropriate steps to make sure we're kind of safely doing that implant. And then there's long-term follow-up. So this is not this is ultimately a therapy that you can mostly manage, by yourself without a lot of help, but you have a lot of resources at your disposal. So you have our clinic and our team. You have the Medtronic team. If you move somewhere else, we can connect you with Medtronic team in that location. So you don't just get this device and you got to figure it out. It's not like you bought a new smart TV from Best Buy. Now you got to try to figure it out at home on your own. Like we have plenty of support to help and follow up with you throughout your journey. So as far as I think I've hit most of this, but during the trial, during that test period, what we're going to do is we're going to implant 2 temporary test electrodes, and so those are basically temporary versions of the permanent, and we're going to stimulate with just those 2 wires in position, and then we're going to tape this little receiver to your back. It kind of has a little pouch that sticks to the skin, and then so everything's external except for the 2 little wires. And then we send you home for the week, and then we touch base and we see how well it's working for your pain. And then we're like I mentioned before, we're going to want to set some goals as we're trying to decide if this is effective and going to be a good option for you. So, can you stand longer when you're doing your dishes or at the sink? Can you sleep for longer stretches of time with no pain? Can you walk to the mailbox and back without any trouble? Like what are some things that really limit you that you want to see if you can now do with this device? And at the end of the test period, if this was really great, then you can move on and go move forward with implant. And so we really want to see that this trial or test period is really successful. If it doesn't work, if it's not really helpful, it's 100% reversible. Basically, 2 little stitches at the skin get cut, those temporary wires come out, and then you're kind of back to where you were. So, as far as the trial period, the best part about it is you can really test drive it without having surgery. So if you've had back surgery before, did you get to test it before you had your back surgery? If you had your knee replacement, did you get to test it before you got your knee replaced? Your hip replacement, you name it. If you have if you've had any kind of surgical intervention before, almost assuredly you didn't get to try it out for a week before you got it to see if you really wanted that surgery. So I think that's really powerful, and it's hard to understate the value of the test period. And then as far as the results and relief, we're really looking for pretty significant relief. So I wanted you to be pretty definite that this worked, and so. This is something where routinely, when it's working well, people are coming back saying their symptoms are 80% better. They were standing for a lot longer. I remember, I had a guy that in the office not that long ago was said like he went out for a 4 mile walk, and I was like, okay, well, how far do you normally walk? Well, usually about a half mile around the block. I'm like, well, okay, well, that is that's something that I don't think I've ever had a pill that I've given someone where they come back and they increase their ability to walk and do an activity by like 8 times. Like that's pretty substantial. So, generally when this works well, this is pretty noticeable. And that follow-up visit, we're talking about success. It's a pretty obvious no-brainer. And so where does this trial take place? In our practice in PPTI, the majority of them will happen at our ambulatory surgery center. So that is for those of you that are here with us tonight in Loveland, that's just on the other side of the building here. This is a sterile procedure, so we want to make sure that we are using full sterile technique and making sure we're appropriately gowned up and gloved up, and that happens best at the surgery center. We have that great controlled environment over there. It can be done in the office. That is an option, but ultimately that's usually reserved for scenarios where we don't take it to the surgery center. Office setting is a clean environment, and surgery center is a sterile environment. As far as the length of the trial, I think I kind of buzzed past that in the last slide because full disclosure, I do a pretty good job of this procedure. In that last slide, I just buzzed over, said it takes 30 to 90 minutes to do a trial, and it doesn't take anywhere near that long for me. So I could typically do a trial in 10, 15, 20 minutes. There's going to be a little bit of time prepping you, a little bit of time afterwards. But this is not a really long procedure. So I think, I talk to patients with chronic pain. I tell them you're going to lay on your belly for 90 minutes. I think a lot of you guys are going to probably look at me a little cross-eyed, like I'm not sure I want to do that. So if you see that out there as you're researching this, or if you screenshot that slide I just slipped past, I think just keep in mind this procedure is not a really long procedure. If it's really complicated, I guess maybe, but I haven't done a trial over 45 minutes an hour since I was first or second year out of training, and I'm 12 years into my career at this point. It's kind of weird to say that. I had a patient ask me this morning how long I've been in practice because he'd been my patient since the beginning. And I was like, oh yeah, about 11 and a half years. And I did the math. I'm like, wait, 12 and a half years. Oops. So, again, I kind of teased up how long does the trial work, or how often does it work? And, I said kind of when it works, and I kind of almost said that in a way to make you kind of wonder, is this how often is this trial actually successful? Well, the data and the clinical trials that have looked at this, 87% of the time this is successful. This is something that if we test this for you, that 8 or 9 times out of 10, it's going to work. So this is not something where it's a 50-50. Go see your back surgeon of choice and you ask them about back surgery, what's their classic answer? Like 50-50. And it's not going to help your pain, it's going to help your function. Obviously we're talking about neuropathy and diabetes, and there's not a spine surgery for this condition, but I love analogies. That's kind of how I explain the world. And so this is a very successful therapy. Almost 9 out of 10 times the trial is going to work, and you're going to move on to the implant. Will it work better than my medication? And it's almost a slam dunk yes when it works well for you. So if you're one of those 9 out of 10 patients, the research studies show that spinal cord stimulation is 17 times more likely to experience significant relief compared to what they're already doing. So you take your gabapentin, your amitriptyline, your Cymbalta, your Key-Tenza patches. This is significantly better. This is really night and day difference. So a lot of those medications, like in a lot of those treatment options for diabetic neuropathy, the success rate on that is well below 50%. I mean, it's been a little bit since I looked at the data, but I think like some of those medication options like gabapentin are about 30% effective for diabetic neuropathy. So we're talking about a significantly more effective therapy. Your pain is personal. You do have choices when it comes to these devices. So as I mentioned, we have your successful test period, and then you want to trial it and it works, and then you want to go down to the permanent. Then we have a couple of different options for battery. So there is a battery there's two big types of charging two big battery options. There's charging batteries, and there's ones you don't charge at all. So the benefit of charging is it's going to last a lot longer. There's a good option called Vanta, which is a prime cell or non-rechargeable battery where it works for several years, and you basically have a remote where you turn it on, turn it off, turn it up, turn it down, but you don't really need to charge it. So it'd be like if your cell phone is going to last for several years, and then you got to replace it and get a new phone. The rechargeable options, when it comes to that, generally will extend the battery life pretty significantly. So we're talking, the Intellis battery is going to last a decade, 10 years. The Inceptive battery is going to last 15 years. The Intellis Pro battery is 15 years as well. So like there's really great battery life when you charge it. So charging is not a huge burden. Typically we'll charge from 0 to full in less than an hour, so about an average about 45 minutes. And you're not necessarily charging every day either. You're charging every few days. So there's options, a lot of things to talk about. One of the huge benefits to the rechargeable option is it can unlock really the latest and greatest therapy option that we have, which is called closed loop therapy. So it's a kind of like a self-driving car, so it keeps the simulation on target all the time. When you have your successful tests, and then we're deciding on permanence, you just keep in mind there are a few things we're going to decide for moving forward, and it's patient dependent. It really depends on what is good for you. And one of the beauties of working with Medtronic is this is really can personalize it, help you make the best choice for yourself, and it is options. It's not just one of these three choices you got up there. As far as the implant, so this is an outpatient procedure. So this is a soft tissue surgery. So I don't cut any muscles, ligaments, bones, anything like that to implant this. I make a small incision in the middle, and then I use a needle to place the test electrodes, and then I make an incision off to the flank, the love handle on the left or the right for the battery. The batteries are fairly small. So for those of you that are able to see the slide, it's bigger than a quarter. The rechargeable ones are about the size of an Oreo cookie. And then the one that you don't have to charge is a little bit bigger than that, but ultimately that's, to be able to provide that extra battery power so you don't have to charge. So keeping in mind that this is not a very big device. This is and then this is an outpatient procedure. So it's going to take, I would say, time in the operating room is about an hour. So there's a few minutes on the front end for anesthesia to get you set up. You get cleaned off, you get draped, everything sterilely. Procedure itself takes between 30 and 45 minutes, and then a few minutes on the back end to wrap up. As far as the implant, it's almost always done at the ambulatory surgery center that I mentioned earlier, in our Loveland office. And then if there are patients who have really significant medical comorbidities, there is an option to take to the hospital. But ultimately, one of the really important things with these devices and with a lot of surgeries in general is that the place where the surgeon is frequently doing these procedures is generally where you have the least complications. So if you're a surgeon that you see who's doing your stimulator implant, if it's like, for instance, myself, the place where I'm there every week doing surgery at is a very safe and good option. If it's a hospital system that you may not go to as regularly, there's always factors there. But ultimately, just know that this is intended to be a very safe outpatient procedure. Recovery time is pretty straightforward. So typically, you're going to be back to feeling pretty good within a week or so after surgery. But I do limit some of your activities for up to 2 months just to make sure everything heals in properly. So when this therapy is working, it's doing well. It's a lot like laying down sod out in the grass outside. So the grass looks nice and green, but under the surface, the roots got to take hold. So we need up to 2 months to make sure that the tissue and everything holds together and gets everything back to its normal tensile strength, so that everything stays in place and continues to be a good therapy for a long time. All right. How long does the relief last? This is intended to be pretty much a permanent thing. So the research studies are always kind of interesting when it comes to duration of therapy. So research studies have to end at some point. Otherwise, if you just keep studying something, you never report the data. There's nothing to ever report. So, but right now, we've got data showing this, providing clinically meaningful pain relief for 10 years and counting. So, this is intended to be for the rest of your neuropathy journey. This is intended to be a kind of a permanent therapy option for you. And I think I talked a bit about battery life, which is the next slide. So it really depends. The one thing that just the slide points out is Medtronic, the rechargeable batteries, the ones you charge, have a 9-year warranty on them. So if anything happens to that battery in the next 9 years, it'll be replaced with no issues under warranty. Infection risk. So diabetes is, one of the things that everybody with diabetes knows is they need to check their feet. They need to be mindful of infections and the wound healing, and things can be a little bit slower. But this is a very successful therapy. But when we're trying to decide if you're appropriate for this therapy, we're generally going to look at your history of infections, but also we're going to look at your hemoglobin A1C. And so for those of you with diabetes, you've probably heard that your A1C, and you kind of know that number because your doctor is always checking it every few months. That's your average, pretty much a marker of your average blood glucose or blood sugar. And so we want to see that that's on average 7.5 or less. If it's between 7.5 and 8, we may have a discussion about whether it's appropriate or not. But above 8 is generally not recommended to do this therapy at that time. And keep in mind that's, like I meant, a running average, so about a 3-month average of your blood glucose levels. So it's not a permanent fixture. So if your A1C is above 8 right now, it just means work a little harder on the diabetes, get that a little bit lower, get it in the range where your risk level for this kind of treatment is acceptable. For patients who have a higher infection risk, and we do have a lot of options, a lot of things we do for infection prevention. One of the options that's kind of unique to these spinal cord stimulator devices is something called the Tyrex pouch, which is an antibiotic pouch that will release antibiotics for 6 to 8 weeks after the implant, and that can really help prevent infection during that perioperative period. What if you need an MRI? So up to 98% of people will need an MRI within 10 years of their stimulator implant. And Medtronic is really, at the forefront of battery technology and MRI capability for patients. So they're the only company out there that if the system is not functional, for whatever reason, either it's you forgot to charge the battery and the battery's dead, for that something happens to the equipment, whatever the case is, you can always get an MRI. The last thing it does before the battery loses charge is it flips into MRI mode. So it's always setting you up to be able to have MRI access. If one of the little contacts on there is not working properly, so there's 16 contacts in a typical 2-lead system. If 15 of those are working great and your therapy is really well controlled and your neuropathy is under control, but one of them is not working, none of the systems out there on the market outside of Medtronic can get an MRI. So you might have a perfectly working system, working great, and they tell you, "Oh, sorry, we can't do your MRI because we got 1 out of 16 things that isn't working perfectly." Now, if you drove your car to get here tonight, is your car in like 100% perfect health, not a single click or issue, dent, ding, nothing with your car? That's kind of what you need for MRI access with the other stimulators, and it needs to be fully working in full order, no issues. Medtronic, even if it's completely not working, it's still are maintaining your access to an important therapy. So, or an important imaging modality, a really important imaging modality, and a growing imaging modality. So, things that, like I mentioned, career is 12 years at this point, and there's a lot of conditions now that MRI is being used now that it wasn't used when I was in med school or residency or fellowship. So where can you find more information? So there's this QR code here where you can go and you can find more resources. There's a program called Care Guide Pro, which is an app you can download and get a lot of information on there, not only about spinal cord stimulation but other therapies that Medtronic offers. This is a very safe therapy, as I mentioned. There are risks with every therapy. There's not a single medical procedure out there that doesn't have risk. Main risks that I worry about with spinal cord stimulation are infection, like I talked about, bleeding. So if you're on a blood thinner, we want to talk about how we can safely stop that during the trial and during the implant. I want to make sure if you're if you're, as mentioned, your diabetes medications are keeping your blood glucose and your sugar levels in an appropriate range. That if you have those medications, we know how we want to handle them on the day of the trial, the day of surgery, to make sure that you don't have your sugar go too high or too low during the procedure. As far as other things, this is a procedure where we're sticking a needle into what's called the epidural space to place these leads. So there's small risk for nerve injury and for something called a spinal headache. Now, luckily, when in procedurals to do this all the time, this is a pretty low risk for that as well. So this is overall a very safe procedure. So I think it's really important to kind of hammer that home. But like anything, nothing is 100% safe out there. It's really important to know that this is not just for diabetic neuropathy. So that is one FDA approved indication for this therapy, but there's a bunch of others. So one of the most common reasons we do this is failed back syndrome, or people who've had back surgery and it didn't relieve a lot of their issues. People who've have disc problems, nerve problems. Spinal stenosis is an issue with the spine as well. People who develop shingles and then they get postherpetic neuralgia and that just doesn't go away. There's another condition called complex regional pain syndrome. So people who have an injury to an extremity or have surgery on extremity and their nervous system kind of goes haywire afterwards. So there's a wide range of indications for this therapy, with the main focus of this one being diabetes. We I know we're wrapping up. We're getting kind of close here. So I always think about that one commercial where that one heavy set guy is talking about the diabetes. I'm not sure if I remember that, but I keep wanting to say diabetes all webinar, but I figured it probably wasn't the best. But I like to joke I'm a simple country pain doc, so I'll help you with your diabetes anytime. So that's the last slide we got here. I'm going to look and see if there's any questions in the Q&A section, and then if anybody in the crowd here has any questions, you fire away. I don't. Let me see here. I have someone asking here. How much follow-up do you have in the clinic after a spinal cord stimulator? And so generally we're going to see it pretty quickly after surgery to get your initial programming all honed in. When you have surgery and you get anesthesia and things like that, sometimes a little bit hard to set up the device optimally until some of those medications have worn off. But then, so when we see it kind of 1 to 2 weeks afterwards to get everything set up, we'll see it about a month out to kind of touch base, and then I'll see it at 2 months out as kind of a sign off that there's no more restrictions. And then you will have, typically if the system's working well, then I'll see about 3 months later to make sure everything's good. And then I'll pretty much see about once every 6 months afterwards just to make sure everything is good. So, overall, the goal I think is I'm happy to have those 6 month visits. So in my world, everybody's hurting and in pain, and they're kind of complaining. So when I can have those once every 6 month high fives, this therapy is working great. That's a fun visit for me too. Anybody in the audience here have any questions? Yes, yeah. So this is a therapy that pretty much requires your insurance to pay for it. So not everybody's got different insurance benefits in that, but so you may have a copay, a co-insurance, but we want your insurance to cover the lion's share of it. And then if you have an insurance that doesn't have any copays or co-insurance, whatever, then it would be fully covered. Yeah, I know. I saw you earlier today. Yeah. So, as far as this therapy, it's really, I really can't stress enough. It's got that trial, that test period, so you can test drive it for a week. End of the week, if you did great, then you know what you're getting. So I think there's a lot of comfort in knowing the therapy that you tested out is what you're going to get. All right. Any other questions? Well, thanks everybody. We're going to wrap up and have a good night.